One of the really fascinating things to think about is what you just heard from Hugh, is how to actually take that incredible inspiration and think about what would happen if we had in our hands the capacity to heal ourselves and to restore ourselves from devastating injury, from disease, by regenerating restored tissue. In many ways, great job, guys. In many ways, you can think back to the Greek gods, and the first example of this was when Prometheus stole fire on behalf of humans, and Zeus got really mad at Prometheus and sentenced Prometheus to an eternal life of having his liver eaten by an eagle and during the day, and then at night his liver regenerating. And as that liver regenerated, he was prepared for the next day. That's the sort of inspiration all the way back in Greek mythology to regenerative medicine. And the reason is that we heal very differently than, for instance, a salamander might heal, or many other amphibians that can regrow not just limbs, but pieces of their heart, etc., etc. We heal by doing three things. We heal by clotting, so if we're losing blood, our blood has the capacity to create a clot. We heal by inflammation. So our body chooses to replace damaged tissue, both in the presence of disease and or some sort of damage for an injury, by creating scar. And it's an inflammatory process that does that. We all are well aware that if we've ever had surgery and we've had stitches for the rest of our life, we can see where we had those stitches. We're perfectly fine, we're perfectly functional, but we can see that we created scar. Heart failure, many diseases, all respond to injury by creating scar. So how is it that some animals don't do that? And can we learn how to take that capacity and do that in humans, to intervene in what's a scarring process and make it a true regenerative or restorative process? What happens in the body is that the injury is first responded to when a mass of cells shoot from around our body, they go to the site of injury, and they start creating scar and fixing the damage by replacing it with a scar tissue. The idea would be is perhaps we can figure out what kind of cells there are that could give rise to native tissue. We'll call them regenerative cells. Can we figure out what they are? Can we cause them to go to a site of injury? Could we inject them into someone and thereby start to repair tissue? This is called regenerative medicine. And when we do regenerative medicine, everything is different. From the moment that we reset that coordinated series of events that leads to scar formation and just drive down a new road to a new future, everything's different in terms of what you can imagine and in terms of how you'd be treated from a myriad of issues. For about the last 20 years, thousands of people around the world have been working hard in laboratories trying to figure out how to isolate the right cells, to treat the right disease, how to get it into the body, and what to do with them. And as you probably are well aware, there are people that are using our own cells to do this, people that are using so-called stem cells to do this, people that are using stem cells that they take from embryos called embryonic stem cells to do it, people that are using cells from people's skin called induced pluripotent stem cells. It doesn't really matter what they're called, they're a whole bunch of cells. And anyone that would tell you, I have the best cell, and I know exactly what I'm doing, is probably taking a step too far at the moment. But we're learning, and we're learning really fast. There are 2 Nobel Prizes represented by the work on this one slide. And I'm not going to really spend very long talking about cell therapy, because in many ways, cell therapy is kind of here already. And I want to talk about the regenerative medicine that is a step beyond cell therapy. I'd be happy to talk to you later about cells themselves. I just want to sort of mention for a moment that there is, of course, a lot of serious discussion and serious debate that shouldn't be the subject of laughter about the use of embryonic stem cells and whether it's right or wrong. I just put up this slide here. It's one angel saying, I died waiting for embryonic stem cell research to find a cure. What about you? And the other angel says, I was the embryo. You know, these are complex, difficult issues to get one's arm around. But the future has arrived already with cell transplantation and regenerative medicine using cells. We're now talking about hundreds of thousands of patients around the world, billions of dollars being spent by companies inventing that future, thousands of companies around the world, and the FDA beginning now to regulate products on a regular basis and give them approval. So it's a really exciting thing, and almost any kind of serious chronic disease that you could talk to me about, there would be someone somewhere in the world that is using cell therapy for. So that's great. We're not going to talk about it anymore. We're going to talk about the next generation of healing. And it really is a Star Trek-like healing. It's this idea that if we are damaged in some way, particularly in complex organs inside our body, how could we actually restore them and replace them without relying on a classic transplant? This is a field that's rapidly emerging at the moment called whole organ engineering. And I'm going to spend the rest of my time talking to you a little bit about that, and I'm going to focus on 3 organs. And there may be some, if you don't like cooking because you don't like to see the raw liver on the plate, just be sensitive. You're going to see a lot of raw liver and things like it. We're going to focus on the pancreas, the liver, and first we're going to talk about the esophagus. And we're going to talk about complex, difficult problems to solve where whole organ engineering has really already or is about to play a leading role. And the first work I'm going to talk about is my colleague at the Allegheny Health Network, Dr. Blair Jobe, who's passionate about treating liver cancer. And the reason is, esophageal cancer. The reason is quite straightforward. If you get a diagnosis of esophageal cancer, it's a difficult diagnosis to receive. There aren't many options. In fact, what generally happens is if you go and you get that diagnosis, you are told, come back in a few months, we'll see how you're doing. And you're told that until it's time to cut out the esophagus that has a tumor in it, bring the stomach up to the throat, and reattach them. And it's a difficult procedure with very poor results. The unfortunate mortality curves for esophageal cancer are some of the worst there are. And esophageal cancer is an epidemic at the moment. For unknown reasons, it's increasing in its rates dramatically all over the US. So there's a real desire to figure out what to do about it. But there's a problem. And the problem is scar. What tends to happen is some organs respond to injury better than others. We know if we injure our skin, it's okay. And in fact, if we injure our liver, just like Prometheus had, the Greek gods, we can lose 1/3 to 1/2 of our liver, and within 6 months, it'll grow back, working just fine. But the esophagus is the swallowing tube. And what it does is it creates a scar that does what's called stricture, and it just closes. And it closes so much that you can't eat anymore. And it's irreversible. And almost anything you do to the esophagus causes that kind of response to the injury. So you can't go in there and do delicate surgery and take out the tumor because you get that kind of scar. So Blair had a really bold idea. This is just a picture of an esophagus being removed. This is big surgery. There'll be a couple of pictures equivalent to this in a second. Big surgery, bad outcomes. That's an esophageal tumor. That's what Blair has spent his career fighting. But he had this really amazing idea. He said to himself, if I could just invent a way of peeling out the inner lining of the esophagus and replacing it with a material that was regenerative, maybe I could recreate the organ in the body. Maybe it would heal itself. And of course, he had to do a lot of science. It took about a decade. He had to invent a device that would help pull out the inner lining of the esophagus. And what he was really trying to do was resurface the road. So he was saying, I'm going to take out a tumor by pulling out the whole lining of the esophagus and repair it with this material. This material is essentially an organ that has had all of the cells removed from it. It's actually the inner lining of the small intestine. It's had all of the cells removed, but it remains important enough that it can orchestrate a conversation in the body that says, don't create scar here, create natural tissue. So what you'll see in this video is the inner lining of that patient's esophagus coming out, being pulled out. You'll see the deployment of that material that I just mentioned, and then you'll see 4 months later a natural healed esophagus without scarring. And what Blair has achieved here is really quite remarkable. He's done this now in about 18 patients, and in our hospital in Pittsburgh, in the Allegheny Health Network, he's in the midst of an FDA-approved clinical trial to see how far he can take this. The principle is very straightforward. The principle is that the information inside the body that we have that doesn't reside inside ourselves, the superhighway of information through which our cells communicate with each other, that information can reset the healing response from a scarring response to a regenerative response. 2 other examples of pretty much the same thing. This one now for diabetes. Obviously, type 1 juvenile diabetes is a huge issue, about 1 million total patients, and a difficult issue. There are 2 ways to treat it. The first has been done for a long time by this gentleman here. The older-looking gentleman is Dr. Massimo Trucco, again at the Allegheny Health Network. What Massimo does is he takes pancreas, normal pancreas, and he isolates the pancreatic islets that have become defective for a person with diabetes, and he does transplants of those islets back into the body. This is the process by which he does it. He's done about 120 of these, and he, from his little laboratory in Pittsburgh, supplies all the islets for transplantation of this kind at the Cleveland Clinic, in our own hospital, at UPMC, one of our competitor hospitals. So, you know, it's actually a remarkable story. But it doesn't cure the disease, because the immune system is what isn't working in juvenile diabetes. And in many of the issues that many of us face, it's our immune system that needs to be re-engineered. So, learning from the same kind of science that Blair did, he did a remarkable experiment. He said, I'm going to take a thymus, which is the organ of the body, one of the organs of the body that acts as like the conductor for the immune system. And he said, I'm going to take all the cells away, and then I'm going to replace it with new cells from a different, in this case, it's a mouse. He's doing it from a mouse to a mouse. And I'm going to regrow a functioning thymus with a new immune system and deliver that back to my patient. What you see here is the thymus organ of a mouse. It's tiny, obviously. Having all the cells removed, it now looks like a jellyfish. But notice on the bottom that the jellyfish has within it all the structures, has all the little blood vessels going where they need to go, the necessary lymphatic system. So now he just fills that with what are called thymic epithelial cells. These cells are notoriously difficult to grow, which is why no one's never been able to do this before. So he did it, he regrew them, and just this year in one of the Nature journals, he published a remarkable paper where he shows that he can take an animal that has no immune system and provide an immune system using this technique. So this opens the door now, and they've started a major study. It opens the door to some pretty remarkable things. We're going to finish up, so we've gone from engineering the pancreas, engineering the esophagus, engineering the immune system. We're going to finish up by showing the same principle, but for the liver itself, that very organ that Prometheus was experiencing regeneration of back in Greek mythological times. What's fascinating about the liver is that although in the body we can do surgery, so living donor liver transplant is done all the time around the country, and the reason is it regrows. But if you take the liver out of the body and you separate liver cells, you can't get them to duplicate. No one's ever been able to do that. So they decided to take the same approach here. And in this case, Dr. Ira Fox and Dr. Alex Gutierrez, both at Children's Hospital in Pittsburgh, have been on a journey to do something quite unique. And that is whole engineering of an organ, a liver, that would be functional inside a patient. And so they took a liver, they decellularized it, just like I showed you with the thymus. They then repopulated it with liver cells that normally won't grow. Lo and behold, when you do that, the liver cells begin to grow. So in a bioreactor outside the body, they began to engineer this liver, and you can see the liver there in the picture. They then take that liver, and with a variety of very clever tricks, they're able to hook it up to the blood system of an animal. They're able to plumb it in and show that the liver can begin to function as a normal liver. So they're getting close now, probably within years, 5 years easily, to being able to take this to patients who are in need of replacement livers. And there are, unfortunately, far more people who are waiting for livers than there are livers available. So this area of whole organ engineering is really, I think, one of the big next generation futures for regenerative medicine. Regenerative medicine is already here. It is inevitable. It remains really difficult. There are many, many complex issues that have to be solved to figure out how you match the right organ or the right science to the right patient at the right time. This is not easy at all, but it is very exciting. And one of the things that we're most excited about is what we're learning about cancer at the same time that we're learning about regenerative medicine. Because it turns out that as you learn how to control the growth of cells to do regenerative medicine, you learn how tumors are growing as well and what you can do about that. Regenerative medicine is one of those things that really challenges the status quo. We're not really set up to think about the idea that if our liver is failing, we'll just grow a new one. It's a kind of challenging thing to get your mind around, not just for lay people, but it's challenging for people in the industry. So I've heard a lot of people say that it's going to take a long time, and it'll never really be relevant, right? It's just going to take a long time. So I like to end with 2 slides, and they're slides about a bridge in the Honduras. And the bridge is called the Choluteca Bridge. It's the biggest, best bridge in all of the Honduras. And the reason why is that every time a big hurricane comes along in the Honduras, all the bridges fall down. It's a big disaster. You have to rebuild all the bridges. So they built this bridge, and it truly represents the status quo. But innovation is like a hurricane. Science is like a hurricane that just sort of trundles along, and all of a sudden, unexpectedly, it appears. So just like Hurricane Mitch arrived in the Honduras in 1998, a year after this picture was taken, what do you think happened to this bridge? People are saying it fell down. It didn't fall down. That's actually the key. The river moved, right? So the bridge was still there. Still a great bridge. It's just a little less relevant, right? Regenerative medicine will be like this. Regenerative medicine won't replace anything. All the tools that are available to physicians today will remain available. But with these new tools, some of those old things will be a little less relevant, and the future will be quite bright. Thank you.